I passed a considerable amount of blood and mucus. I decided then that I'd have a chat with my female GP because I was a little bit concerned but thought it was probably piles, hemorrhoids, that sort of thing. Looking back, I don't think that my GP really knew what she was looking for. She didn't ask me the questions that I now find are associated with bowel cancer. She did refer me to the hospital, and it was the hospital that confirmed that I had a sigmoid tumour following a sigmoidoscopy. I'm now concerned that there are other people like me who are walking around not knowing what they might have. My GP was unaware. She did an examination, didn't think there was anything to worry about, by which stage I was already at stage 4 of my cancer.
My first experience of hearing loss was about 10 years ago. It was hereditary. My mother had had problems. I knew that it was likely, but I was beginning to find it really hard to hear things. I gave up my job as a teaching assistant, partly because I couldn't hear and partly for other reasons. I became very introverted. I decided that actually I was on the scruff heap, and I just didn't really go out for about a year. I lived for about 7 years without any support, with my hearing gradually deteriorating. It's a very scary, very depressing, isolating experience. You gradually stop going out from going out anywhere, going to places where you know you're not going to be able to hear. Even shopping can be a really scary experience. At the hospital, it was quite amusing when I first went for my hearing test, because I was sitting in the waiting room waiting to see the consultant, and they came out and called my name. Didn't hear them. I couldn't hear. Their system of actually calling you was by voice. Well, if you're deaf, you can't hear. It's just something you learn to live with, and you shouldn't have to learn to live with being deaf. It's something that something can be done about.
I had a big change in my bowel habit. I went to see my GP, who sadly didn't think it was serious, didn't think it was bowel cancer, and I left with no medication and no referral. He didn't give me much time, he didn't examine me properly, and sadly he didn't therefore identify the disease. It was very, very annoying, but actually my initial reaction was one of disempowerment, feeling I didn't know what to do, I didn't know where else to go, and a feeling that I couldn't do anything about it. So it was a mixture of frustration and helplessness initially was my feeling coming away from the GP. I was fairly clear in my own mind that it was bowel cancer, but I could see that the only way I was going to convince my GP was to wait and see if the symptoms persisted. And at about that time I started to have blood showing when I went to the toilet, and it was very clear to me that if it was both the change in bowel habit and blood, that the symptoms were very strong. So I went back to the GP and saw a different GP within the surgery who made an immediate referral. Well, I think they've done a tremendous job in this country putting in the screening program. I think there are two things that the screening program needs to really make an impact on this, to bring bowel cancer down in terms of the number of people who die, and that is to put money and effort into raising awareness and educating the public, and there's nowhere near enough on that. And secondly, to make sure that the National Health Service, GPs in particular, are also educated and made aware of it.